I'm going to show you how to set up an installment plan. So let's say I am on a patient's file. I have a project to do some upper front teeth on implant, and this is the treatment plan. The patient wants to pay following an installment plan. I go to installment after selecting all what is in this project. I click on installment, and I have the installment amount which is coming here. The starting year is this year. If you are in December and you want to start payment next year, you will go to next year. By default, June is here. This is the current months. By default, 15, half of the months is there, but you can change it. And by default, it's 6 months, but you can change it. All that is editing a table where you have all the installment and the payment to do each month. You can change this amount on top. You can also change this amount, make the first month bigger and the other month less. So I'm going to do 15,000 for the first one, and it will change all the other installments. So you go to installment. If you have several installments, you can select which one you want to do. We click on that. By default, it will come back as it is now. And we can save in history and print. So doing that, we are saving the treatment plan of this patient, which is coming like this. We can print, we can send, we can ask the patient to sign it. All what you want is there. And it's very easy to change it, and it's very easy to keep it. So what we are going to do now, we are going to go in reports, and we are going to see in reports installment. So now we have the installment which are in reports, and we are going to see the installment of this patient. So now we have all the patient. And if I want to look at this particular patient, I search by name, and I have this patient's name here. You see the status is active. We cannot have 2 installments active at the same time because we cannot do 2 projects at the same time. We cannot finance 2 different projects for the same thing at the same time. So this upper front teeth on implant, we are going to make it inactive, and we are going to go back to the patient's file, and we are going to make another one because the patient says it's too expensive. I want a denture. So if the patient wants a denture, we are going to go to a new treatment plan. The new treatment plan will be called denture. So we go to the denture treatment plan, and we are going to make extractions. It's coming. Extractions will be done, and the denture will be done. Surgery, extractions, here, and we are going to do a removable denture on the upper, on these 2 teeth. So this is the new project. If you want to make another installment on this, you click and you put on installment, and you have the installment of this case. Doing that, I save. I go like this, save. It's saving all, and this is the new treatment plan, which is much cheaper than the first one. And you will say that if you want to pay with post-dated check, we can do that. If you want to pay by bank, you can send money to this bank. This is the bank account by default of the clinic, or you can come to the clinic to pay by card if you want. So all this is done in this way. When we go to report now, we go to installment, and in installment, we will be able to see all the installment of all the patient, including this patient we are working on with the upper front teeth on implant or the denture. And if we want, we can make this one inactive and the other one active. And doing that, we will be able to send all the data to the patient, link to the project they want to finance with the financing settlement plan. You know all about that. I think you can use it very easily, and it saves a lot of time and it avoids making a lot of mistakes. I thank you for your attention.